Excess estrogen leads to premenstrual syndrome, swollen and painful breasts and abdomen, headaches and migraines, pain in the ovarian area, lower back pain, leg pain, cravings for sweets, and irritability. We know that when we have an excess of estrogen in the second part of the cycle, which should be dominated by progesterone, this excess of estrogen lowers serotonin, and by lowering serotonin, it generates food compulsivity, and this is due to an excess of estrogen. Hyperestrogenism can lead to menstrual syndrome, endometriosis, dysmenorrhea, prostate cancer, overweight, fibrocystic breasts, benign prostatic hyperplasia in men, cervical dysplasia, and breast cancer. Notice that when we have an excess of endogenous estrogens, this tends to produce an increase in copper, an increase in ceruloplasmin, and a significant increase in histamine. This small detail is very important, along with decreases in vitamin C levels, magnesium levels, and vitamin B levels, and B. Excess estrogen, when it generates an excess of histamine, will produce migraines because histamine causes vasodilation, making the arteries more porous, leaking certain substances and triggering migraine processes. Additionally, histamine also produces eczema and is related to allergies. The excess of histamine causing vasodilation leads to a decrease in peripheral resistance, which results in a decrease in blood pressure. It also leads to issues with fatigue, anxiety, irritability, and very shallow sleep. Notice that due to a histamine problem generated and produced by an increase in estrogen in the second part of the cycle, which should be dominated by progesterone, excess estrogen can lead to flow throughout the month, a tendency to fluid retention, a lack of energy, and also problems with hypothyroidism. This is very important. Excess estrogen decreases thyroid function, which generates internal cold. This internal cold produces heavy periods with dark clots, because when one has heavy periods with dark clots, the darkness signifies cold, and that cold generates menstrual pain. Dysmenorrhea, caused by excess estrogen that lowers thyroid function, resulting in that internal cold. It can also produce 2001 problems with fibroids, fibrocystic breasts, and cysts in the uterus and breasts. It can also lead to a problem of endometriosis and fluid retention due to the increase in aldosterone. We said that aldosterone retains sodium, and where sodium goes, water follows. This results in true fluid retention. It can also lead to a lack of oxygen in all the cells of the body, which causes fatigue and muscle contractions. Well, when we want to study hormonal physiology in both men and women, we need to look at what happens in the liver, what happens in the intestine, and what the influence of certain genes is that modulate and regulate estrogen metabolism. We also need to review nutritional epigenetic patterns that can affect the genetic expression of the genes that regulate estrogen metabolism. Well, at the dietary level, there are foods that improve and others that worsen the situation, but there is an enzyme called aromatase that produces estrogens from androgens in fat, and we need to inhibit it. But it is also necessary to regulate the estrogenic toxins that come from external sources and that are added to those produced internally by our body. Men also produce estrogens, although less than women, but it is important to check that their index finger is equal to or shorter than their ring finger, because the male hormone, androstenedione, and testosterone allow our body to produce estrogens through aromatase. That is to say, starting from rheumatism, aromatase is activated by insulin, and insulin is influenced by white bread, white rice, pastries, baked goods, potatoes, pizza, pasta, and sugars in general. When you activate the aromatase, you are transforming testosterone and androstenedione into estrogens. So we see that diet also plays an important role in the modulation and direct regulation of this excess estrogen. Well, there are people who have a gene, the CIDA, that codes for the production of aromatase, and 2001 of them have it accelerated. In men with this gene that encodes the matasa, it will cause breast enlargement, an increased risk of prostate or thyroid cancer, and also more fluid retention. Estrogens also produce thick bile, eventually leading to gallstones. Sometimes we ask why these stones are formed in the gallbladder. It may be due to excess estrogen that thickens the bile, leading to gallstones, 99% of which are cholesterol stones, well, excess estrogen can also cause constipation problems. This enzyme, which is aromatase, is found in the liver, in the skin, and in fat cells. Therefore, the more fat you have, the more aromatase you will produce, and the greater your capacity to produce estrogen. Therefore, if you want to reduce estrogen levels, it is a very good idea to lose those extra pounds. Well, this gene CID19, although there are people who have it genetically accelerated, there are factors that can accelerate it even more. For example, it is very common for smokers to develop breasts, as well as with alcohol. Sugar increases insulin levels. We have said that insulin activates aromatase, and aromatase transforms testosterone into estrogens. We also know that cereals, sugar, alcohol, and anything that contains sugars, through insulin, activate the formation of aromatase. If we cannot metabolize estrogens, this will lead to an increase in fat in the areas where estrogens interact. We have said that men can accumulate fat in the abdominal area, while their legs will be thin, without glutes, without breasts, but with a belly. But there are also many men who accumulate fat in the breasts, buttocks, and thigh areas. This is due to that excess estrogen. As we age, the activity of aromatase increases, meaning that the older you are, the more activity you will have. For this reason, many women stop producing estrogen in the ovarian structure. 2001 at menopause, and their own fat becomes an ovary. This is precisely due to the hyperactivity of aromatase, which induces the production of more harmful, more damaging, and more aggressive estrogens at the fat level in a woman's body. Well, how do we know if this gene is accelerating aromatase activity? If we find women with precocious puberty before the age of 10, a tendency to form fibroids, endometriosis, fibrocystic breasts in men, and the appearance of gynecomastia, we know that this gene may be accelerating the entire process of aromatase. Foods that slow down the aromatase, such as grapefruits. Consuming 2 grapefruits a day in less than a month helps to reduce issues with constipation. A menstrual cycle should last about 28 days, with a normal range between 24 to 32 days. Ideally, it is 28 days. Short cycles are associated with decreased levels of progesterone. The progesterone, produced in the second part of the cycle, especially during the luteal phase, is much better for women. The more progesterone you have because it is diuretic, 2001 is antidepressant, and it activates the thyroid gland. If you notice, it does the exact opposite of what estrogens do in this second part of the cycle. The increase in progesterone, as we have mentioned, occurs in the corpus luteum. It maintains the uterine lining and the endometrium and increases blood flow for potential fertilization, reduces elevated estrogen levels. It protects and is beneficial for fibrocystic breasts. It stimulates the thyroid gland. We have said that estrogens, on the contrary, decrease thyroid function. It improves fat burning. It is diuretic, so we avoid fluid retention in this second part of the cycle. We also know that it is antidepressant, protects fibrocystic breasts, and in fact, within the context of official medicine, there are progesterone creams to treat these fibrocystic breast issues. USAN also stimulates bone formation, and we remember that before estrogen disappears. When menopause arrives, progesterone also disappears. So we should also check how progesterone is related to issues of osteoporosis. It improves coagulation, is a precursor of cortisol, and is a precursor of stress hormones. Progesterone begins to decline from the ages of 30 to 35. So from this age onward, we should include foods that increase progesterone levels and assess the levels of vitamin D and zinc, which help maintain healthy progesterone levels. In women who have short cycles and low progesterone, help can be provided with passion flower, fenugreek, and by including foods rich in zinc, such as sesame, peas, nuts, pumpkin seeds, and shellfish like mussels, clams, and shrimp, as well as foods rich in vitamin D. We know that vitamin D, blue fish contains a little bit of vitamin D, egg yolk contains a little bit of vitamin D, shiitake mushroom also contains a little bit of vitamin D, but above all, the sun, the solar reaction, in combination with cholesterol, is the main source of vitamin D. We know that vitamin D is truly a pleiotropic vitamin, And this pleiotropic vitamin interacts with almost all structures of the organism. Well, we know that vitamin D is preventive against Parkinson's, preventive against Alzheimer's, improves brain cognitive functions, is antidepressant, and we will see why it is antidepressant. Here we would have, there are two types of receptors, TPH receptors and Hausen receptors. And we know that at the intestinal level, we have the TPH, and at the brain level, the TPH. Well, if you notice in this slide, when tryptophan reaches the presynaptic terminal, we need a high concentration of vitamin D that interacts with this type of receptor. And this tryptophan is converted into 5-HTP, which is subsequently transformed into serotonin. But notice, in the presence of omega-3 EPA at the presynaptic terminal and omega-3 DHA at the postsynaptic terminal, when we have good levels of vitamin D, good levels of EPA and DHA, that neurotransmission functions properly, which improves depression, anxiety, and nervousness. However, when we have low levels of vitamin D, low levels of EPA, and low levels of DHA, tryptophan arrives and can hardly be converted into serotonin, leading to problems with nervousness, irritability, depression, and compulsive eating disorders. To illustrate how important vitamin D is and the interaction it has with tryptophan in combination with omega-3 DHA and EPA to improve neurotransmission at the brain level,